Up, Chuck! You! Talking to Ralph on the big white telephone. Alright, I don't even know what that means, but apparently this means to throw up and to vomit. Tasting the rainbow. Paying homage to the porcelain god. Reverse paracelsus. However you describe it, the stomach flu is no joke. Get it? Ah! Yes, that's me being a hilarious comedian. In today's video, we're going to discuss gastroenteritis or the stomach flu. Such a terrible problem to have. We'll discuss exactly what is it. We'll discuss how do you get it. We'll discuss the symptoms. How do we treat this? And at the very end, I'll discuss how you can prevent it and when you need to see a doctor like me in case it's something else beyond the stomach flu. Guys, let's talk about poop. Howdy y'all, Dr. Islam here, aka your poop guru, trying to give you, yes you right there, the best tips and tricks so you can live your best life from the top all the way down to your bottom. If you haven't already, don't forget to smash that like button. Like, share, and subscribe. And if you haven't already, don't forget to subscribe to my weekly newsletter where you get great tips and tricks like you're learning in today's video. Gastroenteritis. What a pain of a condition do you have? Let me tell you a story of a patient of mine named Lorillo. So I saw him a couple of days ago and he was telling me his experience of having the stomach flu. Let me know if you feel the same way when you've had this condition as well. He noticed that he started feeling sick in the middle of a shift, had this queasiness, just upset stomach. And all of a sudden he had to run to the restroom and was vomiting his head out. He literally could not stop vomiting. As soon as he got done, he told his shift manager, hey man, I gotta go home. He spent the next 24 hours in the toilet, using the restroom, vomiting. It was not a great experience. In fact, he lost almost 8 pounds. When he came to see me, we knew it was a stomach flu. We did some testing, gave him some fluids, gave him some anti-nausea medication, and he felt so much better. So what exactly is gastroenteritis? This is what's called the stomach flu, in which you have some sort of infection invading your GI tract to cause all sorts of gut issues. This is one of the more common infections people get all the time, and we see this constantly, and this can lead to clinic visits, hospitalization, ER visits, or just feeling terrible at home. So how exactly do you get a gastroenteritis? Great question. I'll answer that. Thank you very much. So 2 main ways we can get this. Number 1 is that you can get this from getting infected from a person who's actually sick with this. So you have a family member or a friend that has a viral illness. They come in contact with you, whether it's shaking hands, give you a hug, a bro hug, or whatever. You get that infection into your system through your mouth. You actually have the gastroenteritis from that. The second reason is that certain foods can be contaminated or spoiled. You eat them, and that causes you to have the gut issues as well. So when you've had gastroenteritis, you know what the symptoms are. They suck. But I'll tell you exactly what the most common symptoms are from a gastroenteritis. Really bad diarrhea, especially watery diarrhea. Nausea and or vomiting. Stomach pain or stomach cramps. Aching muscles or headache. And sometimes people can actually have a fever as well. Now, depending on where or how you got the infection, sometimes these symptoms will be immediate, or they can be up to 3 days after you actually had that exposure to either that person or to that food. And in terms of severity, it can range. For some people, it can be very mild, just kind of and a little bit of diarrhea, to severe to the point where you actually have to be hospitalized because you are so dehydrated you can't keep anything down. For the vast majority of people, it'll last maybe 24 hours, like a 24-hour bug, or maybe a couple of days. Now, because you're having symptoms that are very common with other infections like salmonella poisoning, E. coli poisoning, or even C. difficile diarrhea, there may be further testing and evaluation to make sure we know exactly what's going on. So how exactly do we treat this? Well, in most cases, you treat the symptoms and the consequences from that. Have nausea? Give anti-nausea medication or maybe some ginger. Have pain? Give some peppermint or some anti-spasm medication. You are vomiting and puking your guts out? Give you some fluids, some hydration to drink to keep your fluids up. But we really don't have any effective treatments to treat a gastroenteritis except for treating the symptoms themselves, unless it's due to a bacterial infection, and in that case, we may give antibiotics. But the best way, by far, to fix this is to not get it in the first place. So prevention is key. Here's what you need to do to make sure you don't get a gastroenteritis. Number 1, wash your hands. It's as simple as that. Get those bubbles, get that hot water and rub. Wash your hands clean to make sure you don't take anything infected into your body. Number 2, be smart about what you eat. If it doesn't look good, if it doesn't look cooked, don't eat it. If it's not made in a place that has high quality in terms of how clean it is, don't eat it. If it's street food that you're not used to, don't eat it. If it's water that doesn't look very good, don't drink it. You know what to do, guys. Come on. Everybody knows this, but I know sometimes we overlook the simple things. If in doubt, throw it out. These are words to live by. Hey, I want to thank you for watching. If you haven't already, don't forget to smash that like button, comment down below. Keep your personal items separate. You guys are big girls and big boys. Have separate plates, have separate tableware, have separate forks. Separate it so you don't get contaminated by what other people are using or having. Prepare your food safely. Wash your vegetables. Wash your fruits. Have a clean surface. Make sure you do things properly and sterile so you don't accidentally infect yourself or infect somebody who you love. Like I mentioned before, disinfect hard surfaces. Use bleach wipes. Regularly wash things out. If you see residual stains on there, clean them up. Guys, do a good job of fixing these things up. So when it comes to the stomach flu, do you just write it out? Or at what point in time do you actually need to see a doctor? Here are my tips. Number 1, call your doctor if you can't keep anything down for more than 24 hours. If you become dehydrated, you lose electrolytes. That is not safe. You need to speak to your doctor to see exactly what's going on. Maybe get some fluids, maybe to check some labs as well. Number 2, if you've been having vomiting or diarrhea for more than 2 days, this could mean something else is going on than the typical viral gastroenteritis. Number 3, you're throwing up blood. Don't do that. That is not good. Don't ignore that. See a doctor for that. That is not normal. Number 4, you're feeling dehydrated. You get dizzy when you get up. You're not peeing as much. You have dark yellow urine. You feel dizzy and weak. These are signs of dehydration that should not be ignored. Number 5, you have severe stomach pain. That's just not getting better. You have diarrhea with blood. Blood is not normal. That is not a gastroenteritis. Blood came from above, blood from below. Not normal. And lastly, you have a fever greater than 104 degrees. Here's my call to action for you. If you've ever had the stomach flu, you know how much it sucks. Prevention is key. Implement those areas of prevention starting today. Wash your hands. Separate your food and your containers. Make sure your surfaces are clean. Do what you can now to make sure you don't have the stomach bug in the future. My question today for you, have you had the stomach bug? Did it suck? And what did you do to make things better? Comment down below. I would love to hear what you guys have to say. I want to thank you for watching. Don't forget to smash that like button. Like, share, and subscribe. And if you haven't already, don't forget to subscribe to my newsletter. We can get great tips and tricks like you're learning in today's video. Guys, thank you for watching. Don't forget, let's talk about poop. Thanks, everybody.